Hello and welcome to the next installment of LCR's webinar series, Worldview. We try to curate great content for our clients and potential clients to learn a little bit about different areas of our interest of our clients. Today, we're going to be talking about healthcare and how do you navigate an incredibly complex system in U.S. healthcare today. One of the things that I want to do, a little bit of housekeeping before we begin and get into the content of the webinar, is that one of the things that if you have a question, you'll see at the bottom of your screen when you move your mouse around that there are some buttons across the bottom. The one that says Q&A, not chat, Q&A is the best place to put your questions. We'll go through those questions, and at the end, as we get to the Q&A section, we'll see how many of those we can get to. If we don't get to all of them, know that we'll get to those in a newsletter or some kind of follow-up material later on. As this particular webinar is being recorded, so you will get a link later as well for those of you that registered, and you'll be able to revisit this at any time. So also, since LCR Capital, we work in the investment industry, I've got to read a quick disclaimer, as we always do today. We have to make the compliance and legal folks happy. This marketing presentation and event do not constitute an offer to sell securities. LCR does manage private equity funds, but does not offer funds related to healthcare or healthcare investment. If you are interested in seeing LCR project investment documents related to moving to the United States, we ask that you contact your LCR directly so we can confirm you are an accredited investor or the equivalent in your market. We can also then focus the conversation to your individual or family needs. So now that we've got that out of the way, one of the things that we have today is that we're going to talk about what really is the design of the healthcare system in the United States. The system today is about 4.4 trillion. So when you think about that from a GDP perspective, that's bigger than the GDP of some of the larger countries in the world. So you can see that it's enormous. But one of the things that you always hear is that it's always difficult. You can't find services. It's difficult to get insurance in some cases. What we're going to talk about today is some unique solutions in the healthcare side of this business. And the reason, even though it's complicated and it's all these things, one of the most interesting things that I've read is that the United States is the #1 country in the world where people come to get medical treatments and medical services. So even though it's complicated and crazy and all these things, still seems to be the place that people want to go. So we're going to get through some of those things as well. We are very fortunate today to have a great speaker. I'm going to be your moderator today. My name is Gregory Sweeney. I'm the Chief Client Officer here at LCR Capital, and we're looking forward to a great conversation. Our guest is John Profeta. John is a founder and general partner of Medical Excellence Group and Medical Excellence Capital. John also he is the chairman of the Medical Excellence Foundation, which is a charitable organization dedicated to providing grants to support America's most promising healthcare research at U.S. academic medical centers and research institutions. Welcome, John. Thank you for joining us. I think we're going to have a pretty exciting discussing healthcare here in the United States.
Thank you, Greg, and it's a pleasure to be with the LCR clients, and I very much appreciate the opportunity to share some ideas about the U.S. healthcare economy with you and your listeners today. Thank you.
Terrific, thank you, John. I've noticed from your bio that you've been in this industry for over 30 years. Can you tell the audience a little bit about how did you initially get into this industry? And how did you think that this was something that you wanted to make a career of?
I believe that there's a reason for everything. When I was 11, my mother contracted multiple sclerosis. And at the time, it was not at all a well understood disease, and there were very few new or old drugs available for patients, especially patients that had a particularly severe case, which my mother did. I think that experience informed my desire to choose healthcare over other promising industries that might have been available to me when I graduated from school. I think it was the driving force. So for me, it was a very personal mission, not only a mission for the companies that I work for, but also a personal mission to hopefully make a difference in what I believe is an essential industry.
That's terrific. And it's great to hear that you had a personal interest that drove you to this part of the industry. I love to hear stories like that. Given that you've chosen this particular path in the medical industry, what are the milestones that you saw that led you to come up with this concept of medical excellence in creating this particular business?
Sure. Let me first explain what Medical Excellence Group is and the difference between the two organizations that you mentioned. So Medical Excellence Group is a grouping of regional companies that we created to manage healthcare for individuals around the world. So we precept family offices and individuals from family offices from 15 countries around the world currently, and we bring them to the United States to receive their healthcare, both preventative as well as, if necessary, advanced and complex disease management programs. The second organization happened because of the good work that we did for a patient. One of our patients, we were able to get his father an investigational drug for lymphoma. His father was told in his home country that he had about 3 to 6 months of life left. So his son, who had some significant means, wanted to see if there were any other opportunities for his father. Fortunately, and his father was being originally being cared for in Germany, and we were able to find an investigational drug in the United States at Weill Cornell at the time that was quite promising for his particular lymphoma. We were able to get him into the program, and his father lived an additional 9 years. So that was a significant change in life. And as a result of that, this patient's son, who became a patient of Medical Excellence Group, as well as a good friend of ours, approached me about 3.5 years ago about the idea of building a capital company, a venture capital company to be very precise, organized around scientists that are creating new drugs. So we have a $150 million venture capital company that is organized solely around finding new drugs for the biggest, most important and unsolved medical problems in synthetic biology, regenerative medicine, gene and cell therapy, and AI where it meets drug discovery, all under a precision medicine umbrella. So to answer your question directly, the idea for Medical Excellence Group, the patient services company, came up as a result of some consulting work that I was asked to do by my business partner, Hank Greenberg. He was the former chairman of AIG Corporation and one of the most powerful business people in the United States. And Hank was the chairman of New York Presbyterian Hospital, Columbia and Cornell's hospital in New York. And he asked me to do some consulting there in their international department, which I was delighted to do. And what I found was very interesting. As great as they are, and they are very good at what they do, somewhere around 5:30 or 6 o'clock at night, their international offices actually close, which meant that patients that had come over from different countries and are in the US in getting their health care, if they have an issue, they have to go to the emergency room or deal with the problem themselves. And I thought that was a very incomplete solution. So I came up with the idea of creating a 24/7, 365 program called Medical Excellence to ensure that patients that coming over to the United States not only have the resources in terms of which doctor to go to, but also have a 24/7 liaison and patient advocacy that I thought was required for those types of patients.
That's terrific. And I think that's a great start for our conversation, is to get an insight to how it started, why it's there, and what you do today. So I'd like to back up just a little bit and talk a little bit about where we'll start at the highest level. When you look at the healthcare system in the United States, and that you've had an experience over time seeing it evolve, How did we end up with it structured the way it is today? How did it get so complicated?
There's always the influx of very big money. In the 1960s and the 1950s in the United States, healthcare was a relatively modest business in comparison to other major industries in the United States. Today, if you look at it, it would be either the number one or number two industry in the US. So I think one of the major reasons is because there was a lot of money behind it, mostly government money. If you look at the expenditures, if you were to graph the expenditures over time, you would see that after 1964, after the creation of in the United States of the Medicare Act, the influx of new monies spurred a number of things, including innovation, including new research, and of course, lots and lots of new buildings around the country in terms of medical centers, clinics, and others. So I think money was, and particularly government impetus, was a major factor in terms of the growth of the industry. The other is a very simple one, and it has to do with math. Computational power in the last 30 years has increased faster actually than Moore's law even. So what you've seen in the last 30 or 40 years is an incredible amount of new knowledge in the industry, which has spurred the new growth. But all of that is organized, what I think primarily around computational power.
It's interesting you mentioned that it's all big money, right? And one of the things that I remember several years ago was Berkshire Hathaway, Amazon, and several other companies got together.
Yes.
Collectively, we have hundreds and hundreds of thousands of employees in the United States. Let's get together and create our own healthcare program. And I think for 12 months, they abandoned it. And you think they've got more money than you can possibly think of. They have a lot of brain power. They have a lot of influence, and they couldn't solve that problem, which is interesting.
Yeah. My issue with what they put together was basically, what were they trying to solve? They were solving for X, but X was never well defined. So from my perspective, I think that this is not, their venture was not the first try at fixing the US healthcare system. But what's really interesting from my perspective is, and I'm not overly defensive of the US system, there are a lot of problems here. There are a lot of problems. But most of those problems have to do with the financing of healthcare rather than I think the quality of delivery in the United States is extremely uneven, but generally pretty darn good. And what's important for your listeners and your clients is if you have some knowledge of the system and know how to explore the system and navigate the system, the reality is that at the upper levels, there is no system that is even close to, in terms of quality, the United States system. Where we do very poorly is in the bottom quartile. We are not very good in the bottom quartile. But for individuals that have knowledge of the system and cannot navigate that system, knowing which doctors are the best, understanding primarily what the best healthcare regimen is for them personally, because again, we are now in the era, very much in the era of precision medicine and what I call personalized medicine. The reality is that the US system is actually, there is none better. There is none better than the US system. But getting back to your question in terms of those that try to fix it, there have been a number of united organizations that have come together to fix whatever the perceived issue is on their end. The fact is, I'll just give you some statistics. The US has produced more new patents than every other country combined in medicine. We've created more new medicines than every other country combined. We've produced more Nobel Prize winners than every other country combined. We've been able to outspend everyone, certainly in terms of research as well, and we continue to do that. And I don't think that anyone would argue that our major university system in the United States, the private university system, for the most part, the Columbias, the Cornells, the Harvards, the Stanfords of the world, are probably the best of the best on a global basis.
And sticking with that theme around money going into the right places and things, you hear about Phil Knight and his cancer center is focusing specific to your body, your genome, do you see that as kind of what the future is going to be, at least on the research side, that it's going to be, we're not trying to solve the healthcare system, we're trying to solve health in general and doing it specific to the individual. And do you see that as one of the futures?
Yeah, I see there are a number of projects very much alike to the one that Phil Knight has so generously backed, and Nike. The personalization of medicine is, in my opinion, probably the most important theme of the 2020s. And let me explain why. Generally, when someone gets a prescription today and in the past, and this is changing for the good, by the way, you would get someone that's 70 kilos would get the same medicine, essentially the same drug and the same amount as someone that's 150 kilos. And an individual that is male would get the same drug as someone that is female. An individual that had a certain set of genetic makeup would get the same as any others. That is very much changing. Now, where it's changing today in terms of research is absolutely in all areas, okay? Where it's actualized is in very few areas right now, which is why I think the 2020s are going to be the most consequential decade in healthcare. Because I think, again, getting back to that computational power that we were speaking of, and the aggregation and manipulation and use of data at a very sophisticated level, that's just beginning to pay its dividends. So those investments made in the 90s, in the 2000s, in the early 2000s, are now starting to take root. And in the very near future, one is going to see highly tailored treatment. And I think the treatment side is going to happen first. What's going to lag a little bit, but come pretty close behind, is the most important part, which is the preventative side. So on the disease treatment side of the world, we're going to see very highly personalized medicine for cancer, for diseases of the brain, for physiological diseases. We're going to see extremely detailed and very customized treatment programs and medical regimens. But the area that, and by the way, that's what we invest into. But I have to also say the area that really excites me for the general public and for the general good is the equal amount of research and brain power that's going into the preventative side, which is trying to unlock the mysteries of everyone's individual makeups so that we can target things earlier. So we can look at the genetic code and say, gee, you know, that gene, that's going to cause a problem in the future. All right. Now let's correct for that problem, or at least manage that problem more effectively. The preventative side excites me very much. And I think that, again, this decade, in my opinion, being the most consequential, I think by the end of the decade, we're reaching now close to the mid-decade. So I can say this with some pretty good certainty. By the end of this decade, at least individuals in the United States are going to have available to them on a preventative basis a lot of data in terms of how they can avoid disease, or at least understand what diseases they may get in the future, and then solve for X, figure out how to prevent it one way or another.
So the big buzzword that we've all seen, regardless of what news, or whether it's business news or regular news, everybody's chatting about artificial intelligence.
Yes.
How do you see artificial intelligence playing in what you invested in capital and finding these individual solutions? Is that a big buzz in your area that seems to be important?
Yes, and of course that is the very essence. It's the end product of that computational power that I spoke of earlier, right? If we didn't have that computational power, we would not be able to do anything close to AI. AI is a misnomer right now. I would say that the most important area of what we call the arena of AI is actually machine learning, which is the use, the aggregation of data, the manipulation of that data from very large data sets down to the individual that allows clinicians insight in terms of the disease factors that one may have, and then being able to solve for that. So I think AI is a very interesting area. We invest very heavily in that. And as a matter of fact, I would say we have 10 investments in our current portfolio in the capital company. There is not one of those companies that does not have a significant AI strategy. And several of them are AI companies. That's what they do for a living. They discover drugs using very unique data sets and artificial intelligence, machine learning programs. So, Greg, the reality is that AI ML is still relatively early stage, but we've learned a heck of a lot in the last half decade, a lot, and in very fast order. Of course, that speed and intensity is only going to increase because the more information that you have, it's a self-fulfilling prophecy. The more information that you have, the more information you generate, the more information that you generate, the more information you have. And so you're going to see, I think, again, in the areas of treatment, major advances coming from AI in terms of highly, highly customized drugs that are a drug that would be just the perfect one for one individual and would not be the right one for the next individual standing right next to them, which is an incredible advance versus what I talked about earlier, which is historically a much more generic, a very generic approach to medicine and treatment.
That's really good to hear, because I would think that kind of machine learning and advancements, to the point you had made earlier, is that maybe that lower echelon that don't really have much access to healthcare and what they need would be able to provide some solutions for them as well as the landscape changes.
I'm glad you mentioned that. And it's a really incredibly good point that you made that I unfortunately did not mention. So thanks for mentioning that. And that has to do with the AI or computational power. I don't use AI that much. We use it so that people can understand what we're doing, but internally what we talk about is computational power, computational biology. That is the area that is going to best democratize medicine and even the playing field. Now, I'm not going to mention the companies, but we have a couple of investments that are organized just around that, which is how do we democratize medicine? So we have one company where today in the United States and elsewhere, if you need an esoteric, really difficult and hard to conduct medical test, breaking down a cancer patient's genome, you have to go to highly centralized and very expensive labs. With computational power, we think in the next 3 to 5 years, you'll be able to actually walk into, I don't know, a Walmart, a CVS, a drugstore, and get the same test at the same level of quality anywhere in the United States. So to your point, which I'm glad you brought it up because it's a really important one, the other important factor of what's happening today is the cost of healthcare continues to go up, unfortunately. Where I think we're going to make incredible inroads is what I call the democratization of medicine, such that individuals that are not living in a major population center, individuals that are in poorer neighborhoods in the United States will have immediate and affordable access to highly complex and advanced medical innovation. So I'm glad you brought that up. Thank you.
Just questions that run around in my head when I'm listening. It's great.
Sure, sure.
Let's drill down a little bit and bring it and distill the conversation down a little bit around medical excellence and what it is that you do. Can you give me an idea? I think, and maybe in my mind's eye, I see medical excellence as, like, for example, if you're on Medicare, once you hit 65, you get the Medicare supplement. Is medical excellence a supplemental thing to healthcare, or is it an all-inclusive? When you have medical excellence as your provider, it is the complete care and the complete healthcare system for you?
There's no, I don't believe that it's like the what I was speaking of earlier, individual versus generic. So there's no one all-encompassing program for anyone or any family. And I don't think that we're going to be able to find one of those. Medical excellence group, and what we do is we provide healthcare access and healthcare knowledge and healthcare support to our membership. So everybody is a highly prized member of our organization. Every family gets a personal health advisor who is highly knowledgeable about navigating not only the US, but also the international healthcare world. We have coverage of Western trained physicians in 109 countries around the world. And the development of our programs over time have further refined as we assimilated new technologies into our programs. So what today is, on the preventative side, we are doing a lot of genomic work. We are doing a lot of the application of computational biology right into our membership programs, so that our members have the ability to not only access the best doctors, which is critical because you want the best and most informed physicians taking care of you, but the other important factor is having access to the best programs in healthcare, not just the preventative side, but also, unfortunately, sometimes individuals do get a serious medical problem. And when one has a serious medical problem, it's absolutely critical to ensure that they are receiving the state of the science programs. Medical excellence is very good at researching those programs and making sure that we're matching our clients, our members, to the best programs available for them personally, down to their individual genome as well. I hope that helps.
Yeah, sure. Are there any particular stories, and I'm not sure the right question to ask, but are there any particular stories about, for example, someone that does not reside in the United States, and
Yes.
how excellence took a very complicated issue and solved it, or someone
Yes.
that is in the United States and how medical excellence solved that issue?
Sure. We could do both. And the 85% of our membership are individuals that live outside of the United States currently. That's continuing to decrease as the US population, as our marketing efforts in the US increase. But most importantly, also, a lot of our members are starting to move to the United States as well. And as a result of that, we're just seeing a number of formerly foreign members becoming domestic US members of medical excellence. But to get into a couple of case studies, there are times, I break it down, let me put it this way. I break it down in foreign patients into two categories: those that can actually get to the United States if they have a medical problem, and those that can't. So let me go to the latter first. There are individuals that have very serious medical issues, and they're family members of our main members, our medical excellence members. And those are people at times that actually, because of their physical condition, can't get to the United States physically. We have support programs for them. What we're able to do is pair, and I'll give you a great example of this, is for an individual that had a certain form of cancer. We were able to, and that person had a, unfortunately, pretty advanced cancer, which we were able to wrestle and turn around. But we were not able, that person was not able physically to get to the United States. So what we were able to do was get all their data and pair their physician team in country, which was in Europe at the time, with a highly skilled team from Harvard Medical School. And the team from Harvard Medical School consisted of about 7 different physicians, some in cancer, some in endocrinology, and some in what I would call general medicine or internal medicine. And because you need a team to pull these things together. So we were able to guide the in-country physician team on the best and most advanced programs. And we were also able to get, luckily this medicine was approved in their country, we were able to get them the right mix of medicines that were able to turn the cancer around. So we've had that type of experience, and actually that's not an unusual situation for medical excellence. We do about 250 complex cases a year. Roughly 70% of them are in country in the United States, but about 30% of those are actually patients where they can't travel to the United States, but we help them anyway. For the 70% of the patients that can come to the United States, we have a number of turnarounds. I mentioned to you earlier, I think one of the best examples is the lymphoma one, but we also have a very unique situation where we were, and I can use her name because she actually cut a video on behalf of Medical Excellence. We didn't ask her to, she did it on her own, but our friend Julia Gippenreiter, who is Europe's most acclaimed psychologist, she was diagnosed with what was thought to be an incurable pancreatic cancer a little over 10 years ago. And that is generally 98% fatal. And 98% fatal. We were able to actually find a physician at Columbia, John Chabot, who was willing to do the Whipple, the procedure for pancreatic cancer. And he came out of the operating room and he said, I think I got all of it. And boy, did he get all of it, because Yulia and I and my wife Olga and her husband have celebrated 10 birthdays that she didn't expect to have. And so we have a lot of those lovely stories in terms of patients that have come over to the United States to get advanced care. But where we really excel, actually, is in the area of preventative care. And it's hard to tell stories about that, because when you prevent something from happening, it's not really a big story. But I can tell you that there are a number of situations where we've been able to identify very early diseases that would have caused major problems for those individuals down the road. And a lot of it was because of the investigational techniques that we're able to bring to bear through the team medicine concept that we use at Medical Excellence Group. So I hope that helps, Greg.
That does. That's very informative. In fact, that even generated a question that I'm going to insert before the traditional Q&A at the end.
Sure.
Our clients are clients looking to go global, right? Residency here in the United States,
yes,
as well as their home country. Does being a resident change how you can access the services of medical excellence? Because, for example, if an individual comes here, there's a certain percentage of time that once they are in the process of getting their green card, they have to stay here in the country for a period of time. Are those issues with medical excellence at all, or is that actually exactly what you all like to hear and can handle?
Yeah, I would say we're neutral on that from the standpoint that it doesn't matter. It doesn't matter one bit to us. And as a matter of fact, the most important part of that is making the successful transition, because generally a member that's moving to the United States, they have a set of doctors locally in their country. And we want to make sure that all the information flow and all of the patient needs and all of the things that they were used to, they're able to access in the United States as well. So we make sure that the ecosystem that we create in the United States for them is the right one for them. And we also keep their doctors informed because generally they have to go back to their country for a bit as well. So there's a bit of back and forth management, but we do that on a routine basis. And by the way, just as an aside, just shows you how used to we are in terms of this individual's question. Our members travel to 14 countries a year and generally are outside of their main country about 40 to 50% of the time, which means that we not only take care of their needs in the United States and in their country, but we're also able and have to be willing to take care of their needs in a number of other countries during the year. So we've had some wonderful situations that turned out to be great, but which seemed dire. We had a medical emergency of one of our members on Mount Kilimanjaro, and we were able to take him successfully, do a medical evacuation off of the mountain, off of base camp. We were able to get them down, get them acclimated, get them depressurized, and get them the medical treatment locally, as guided, by the way, by a chairman of a department of a major academic medical center in the United States. So we're used to taking care of patients both in the United States as well as elsewhere. So for us, what you just mentioned, or the question that your listener asked, it's neutral for us. We're quite capable and ready to take care of any individual's needs, whether it's in their country or in the United States. We manage that transition quite well, and have had a number of medical excellence members actually move to the United States. So it's not a new theme whatsoever to our company.
Terrific. So it's great to hear because of that focus on your clients. And LCR, we have a relentless pursuit to focus on our clients' needs and being in a collaborative and consultative role, advisory role. How do you see the future of where medical excellence will play, given what you think the future of healthcare in general in the United States is going to be over the next 10 years?
I guess one of my predictions for Medical Excellence Group is that in 15 years, we're not going to be so darn important. I think that's a very good thing. Medical Excellence Group exists because of the complexities of the system and the fact that it's difficult to get access to the elite physicians in the United States. It's difficult to get access to the most important preventative and advanced medicine programs in the United States, both preventative as well as from a treatment standpoint. My belief is, as healthcare, I mentioned earlier, becomes more democratized, is that as the tests become not only less expensive, but more importantly, available to anyone, anywhere, Medical Excellence Group is going to become less important. But the fact is, for the next decade, as that transition occurs, I would say that the opposite side of that very positive coin is that the U.S. system is going to be more difficult to navigate. The U.S. system there's going to be many more choices, and it's going to be important to each patient that they make the right decision precisely for themselves. And I think Medical Excellence is a really good organization. We're really good at doing that. I think that's going to be relevant for at least the next decade, if not the next 15 years. But I also believe that 15 years from now, medical excellence is going to be a lot less relevant than it is today.
And do you see the university healthcare research and development, do you see that continuing to grow over time, or do you think it's going to be going back more towards big business, big pharma and the like?
Yeah, big pharma, the connection between big pharma and the academic medical world is way overemphasized. There is a lot of independence at the academic level, mostly because they get most of their funding from the United States government via the National Institutes of Health and our defense establishment, which actually funds a lot of medical research. So they're pretty independent. I got to say, not pretty independent, very independent. I think the changes that are going to occur are, again, having to do with using the power of data and the manipulation of data, individual patient data and aggregate data, to get new insights in terms of disease, new insights in terms of treatment, and new insights in terms of preventative medicine. But the other thing I want to mention to you, because I think it's one of the areas that you were looking to explore, is at least in the US, there were talks of budget cuts and things like that. The reality is that every year, the Trump administration increased medical research at the federal level by 25%. And the Biden administration has continued that trend, not as sharply, but has continued that trend. It's been eaten up a little bit by inflation, unfortunately, but I think inflation will be tamed within the next 18 months or 2 years or so. But the reality here is that the amounts of money attached to quality programs in the United States, quality research programs in the United States, is actually increasing. And I think that's a really good thing for the industry.
That's terrific. Knowing that you've been incredibly generous with your time, and we can talk about this, I have a million questions in my head as well, but we're getting near the end of the webinar for the direct interview. So I'm going to turn it to the folks, the attendees. If you have some questions, please go to the Q&A segment at the bottom of your screen, and we'll get those questions to John as we can. John, the first one, I think we had two in there. One got, I think we answered, you and I were speaking, so I think that they removed that one. So I think we're okay there. The second one is, as someone moving to the US, how can I get access to the most advanced healthcare providers? I don't know if that's focusing in on traditional United Healthcare coverage or specifically medical excellence, but I would say take it from a medical excellence perspective.
Yeah, and I'll take it generically as well, because I think it'll serve them well, Greg. But from a medical excellence standpoint, our most important job that we have is the expert pairing of our members with their preventative or advanced treatment team. So the selection of doctors in a very precise way is absolutely fundamental and critical to the medical excellence mission. Now, what does that mean for individuals that are coming to the US? Well, already in the US, there is a reality in insurance today, in the American insurance, that not all elite physicians, even at the academic medical centers in the United States, many of them actually don't take insurance anymore. The hospital will take the insurance. So if there's a major medical issue or a major test that needs to be covered, yes, both of those are covered by insurance in the United States. But in many cases, elite physicians in the United States will charge their patients privately. The other important point about that is that many of them also have what I would call full practices. So getting access into their practice is very difficult. Fortunately, medical excellence in many cases have had relationships with these, or I and my team have had relationships with this cast of characters, with these top doctors for decades, if certainly at least for the tenure that medical excellence has been in existence. And this is our 16th year. But many of the relationships actually go back further than that. And therefore, we have unique and unusual access to the top physician class. I will say, though, and this is a really important point, in many cases, those physicians will charge a fee that insurance will not fully cover, and therefore the patient will have to lay out some of the monies in that situation. We also, though, for our foreign individuals, we're also able to get discounts for our foreign patients of somewhere between 20 and 50% off of the international rates that they would normally pay. So I hope that answers the question.
It does, definitely. And while we wait to see if there's another question, I look at it after this conversation that often we get from our clients when they're coming here: who should I speak to invest my money and help my money grow? What I'm really seeing, the takeaway here, is that people should be thinking about investing in their medical future or their healthcare future. and certainly medical excellence is a unique opportunity to invest in yourself.
I couldn't agree more, of course, but I would say that just to put it into perspective, I think 10, 15 years ago, investing into a medical excellence type program would pay excellent dividends. At least for the next 10 years, as I mentioned, there's a timeline to this. At least for the next 10 years, those dividends are going to increase. In other words, being a medical excellence or a member of a program like medical excellence is going to pay more dividends because of the limitations in terms of access, but most importantly, the proliferation of choices and information in healthcare in the United States is just absolutely exploding. And you need somebody that knows what they're doing to figure all of that out in terms of its meaning to you in particular, and how it can be applied to you in particular. And I think certainly over the next decade, that's going to be a signature aspect of programs like Medical Excellence Group.
We've reached the top of the hour, and at this time, I do not have any additional questions from our attendees. John, I'd like to say thank you so much. It's been an honor chatting with you and getting to know more about medical excellence, getting to know more about the healthcare system here in the United States, and the things you're looking at to try to be focused in on people, their individual healthcare and their families' healthcare. It's great things that you all are doing.
Greg, thank you very much. And I just want to mention and take a moment just to say how grateful we are for the relationship with LCR Capital because of the excellent work that you do. And you apply the same principles, which is taking a very opaque and difficult process and making sense out of it for individuals where it may be difficult for them to do that on their own. So we have very alike businesses, although we apply them differently and those principles differently. But the principles that we have, which is dedication to our clients and just absolute complete expertise in an area that's difficult to navigate, I've always thought that we did the same thing. And I've always admired what LCR and you and the team have been able to accomplish.
Terrific. Thank you. So that concludes our webinar series, our worldview for this segment. For those of you who are clients of LCR, on the attendees, remember the client portal. LCR's client portal is always there. This kind of information will be downloaded to the portal. Plus, there's a whole lot of other great information in LCR's client portal. Let us know if you have trouble accessing it, but the portal is your individual view of your journey as you go through the EB-5 process and other. Again, thank you, John. Thank you, everyone. Thank you, attendees.
Thank you, Greg. Thank you, LCR.
Thank you, Anna, for helping guide us through this. And everyone have a balance of your day. Enjoy.